Morning, morning, morning. Good morning. Good morning to you.
All right, so I know lots of us grew up hearing parents or grandparents or older neighbors or friends talking about when the rain is coming, they feel it in their knees and stuff like that. And for many of us, you know, we would laugh and joke about it, but arthritis is definitely a serious thing. And today is also the occasion of World Arthritis Day. We've invited Dr. Gerry Warner, who is Chief Physiotherapist at the QEH, to join us today. So we definitely are spending some time with the QEH today. So welcome on this day, often referred to as WAD. You know, congratulations on the observance. What can you tell us about arthritis?
Okay, thank you for having me. Good morning, everyone. Arthritis is simply an inflammation of your joints. Bajans get a little bit mixed up sometimes with the word inflammation. Inflammation is not pus, that's signs of infection. Inflammation would suggest that it is tender, swollen, red if your skin is enough to show that, painful, that's signs of inflammation. So there's several reasons why this may happen. There are many different types of arthritis, but the two major ones most people know about are osteoarthritis, which is just your wear and tear, and then rheumatoid arthritis, which is where you get an inflammatory reaction where your body sort of almost attacks itself. This can affect you at different stages of life. There's also juvenile arthritis, which is a little bit more worrying because when the children present with joint pain, then the pediatrician would get involved to make the correct diagnosis. The problem with arthritis, though, is that it's painful, and anything that's painful is discomforting. And then people will try several ways to get rid of their pain. And one important way of doing that is through specialized and guided exercise, which is where your physiotherapist comes in.
Well, that certainly is a lot. Are there people who are more prone to some of these conditions than others?
Yes, the incidence of these things will change. For example, unfortunately, women tend to get more rheumatoid arthritis. Persons who do impact sports, I'm sure you would have seen your very high-end performers, NBA type persons, you would see them with lots of joint issues, American football players, etc. People who do high-impact sports, sometimes it's a genetic disposition, and sometimes too your job, if your job involves a lot of heavy labor, over time, if you don't maintain good muscle strength and general fitness, you can get issues.
What are some effective exercise techniques that can help to alleviate the joint pain and stiffness that you're talking about that really is a part of arthritis? We just had a colleague walk up, you know, he talked to you about that, and we hear a lot of people talking about this joint pain. So when we look at that in the context of exercising, then you hear people are out on the road and this and that, and sometimes it feels like it does you more harm than good.
Okay, so I'm glad you brought that up. So first of all, studies will show you that exercise improves joint health. However, if you're in a flare-up, if it's very, very painful, very, very acute, very swollen, very tender, that's not the time to do high-impact exercise. So in your first point is the type of exercise. So low-impact exercise, if you can swim, if you're not afraid of the sea, water is an excellent way of exercising. Cycling is an excellent way of exercising. And walking is also good for your lower limbs. What you have to do in terms of the walking is to get a good shoe with good cushioning support. I'm not telling you to go and buy a particular brand, but make sure that your soft shoe has a fairly thick heel and is comfortable for you. So as you impact the ground, you're not sending abnormal amounts of forces through the area. A physiotherapist will be able to assess your gait, your walking pattern, to help you know how to place your foot properly, again, so that what we would call the biomechanics, the way the joint functions, is as it is supposed to do so anatomically, and you're not creating changes. You mentioned earlier the rain falling and weather changes, and actually that's true. Changes in barometric pressure for your joints, where the nerve endings are raw and exposed, are picked up by your joints, and studies have actually shown that. So yes, they can feel the weather in their bones is actually a very true thing.
Listen, the old people said, the rain is going to fall, I can feel it. It's coming.
So for generalized exercise, we like to suggest, as I said, hydrotherapy, your sea exercises or pool exercises, walking and cycling. And again, you start low impact, and then as you feel better, get stronger, then you can progress. What we don't want you to do is just suddenly start getting up and going, doing high impact exercises, jumping jacks and running and that sort of thing, just out of the blue without having seen your doctor and or being advised by your physiotherapist.
Now, you're chief physiotherapist at the QEH. Talk to me about the role physiotherapy plays in managing arthritis.
Okay, so all of our patients will be referred usually from the orthopedic clinic at the QEH, a massive clinic, several consultants there, and or from the polyclinics or private doctors. Our head of department, Dr. Mosley, is also involved. He's a physiatrist, and one of his skills is pain management specialty. When they come to us, we always assess the patients because we need to know not just what your diagnosis is, but also how it's affecting you. We identify your problems from our assessment, and then we create goals to manage each of those problems. Sometimes you have to include some of our colleagues in occupational therapy. If you have arthritis is affecting the joints of your hand, for example, you'll be provided with a brace or a splint to protect that joint at particular times. If you need severe lower back pain, and there may be a reason where you have to see your prosthetist orthotist to get a corset made, for example. But physiotherapy now, we're going to focus on exercises, and we try to design them so that you are taking careful amounts of weight through the joint, what we would call closed kinetic chain, not trying to get too technical, but using your body's weight as part of the exercise and doing it in a safe way so that your joint, which has the ability to know where it is in space, for example, if you close your eyes and move your finger, you would know whether it's bent or not without seeing it. So there's special nerve endings in the joint that tell you that. We encourage the use of those nerve endings in our exercise so that you can be better realigned and that you can better carry out your normal activities with less pain. We also will guide you when it's painful to know what to do and what not to do. And of course, we manage your pain with particular modes of treatment, which we call modalities. That may include ice, it may include heat, it may include electrical stimulation, it may include laser, it may include ultrasound, but the most important is exercise.
All right, the most important is exercise. You definitely have to take that in hand. Are there any recent advancements that can help people in terms of pain management? Because I know arthritis can be very debilitating,
yes,
particularly for people who have it in a severe way.
So the theme for this World Arthritis Day is really living with arthritis throughout life. So in terms of, especially when you get older, it really becomes a genuine issue. You may like to garden, for example. You no longer can stand up and use your hoe and fork. We would do simple things like encourage a person to use a stool, etc., to sit. But back to your question of advances. So there are always studies. You will now know that diet plays a really important part. So you're going to be looking at your green leafy vegetables, legumes, your nuts, that sort of stuff, decreasing in red meats. We use simple devices that use small doses of electricity to interrupt your pain signal. Simple point, I'm having pain at my wrist. I put a controlled electrical current at the same area. Your brain appreciates the current more than the pain, so your pain has decreased. Simple as that. Those devices are available in Barbados and online. A TENS, T-E-N-S, transcutaneous, that means across the skin, electrical nerve stimulator. Can cost about $30 US, an average about $160 here. That's a useful tool to minimize your pain. That's a safe way of managing pain, for example.
All right, let's talk quickly about the sedentary lifestyle that a lot of us lead these days. And I know often with workplaces, there are often challenges with HR departments and people about having the right chairs. You mentioned having braces for the wrists and so on. We've heard more about things like carpal tunnel and this, that, and the other. Are these forms of arthritis? I know that they're different things by definition, but in terms of the inflammation you talked about in the joints and so on, what are the similarities?
So carpal tunnel syndrome really, there's a tunnel at the front of your hand that several structures pass through, including two nerves. The one with carpal tunnel is the median nerve. Sometimes if the muscles and tendons around here get swollen because of overuse, repetitive use, that puts pressure on that nerve. So that's more a nerve problem. But at the same time, because it's a joint, you can also have a joint issue at the wrist. So biomechanics, ergonomics is the term that we use for this workplace setting. is important, and therefore, yes, HR, wellness programs at the workplace are really important. So your seat and position is important, and there are physiotherapists and occupational therapists can give guidance as to how to set up your workstation. But remember, I mentioned exercise. So even at the workstation, a short stand up, walk around, do a minute or two of stretches, and then sit back down is important. Movement is really, really important. So don't complain that you have to get up from your desk to go to check a file. That movement changes your body position, and that actually works to your benefit.
When we hear about the QEH, we just had the doctor from really talking about sight. And now we're talking about physiotherapy. We don't hear a lot about the physiotherapy
that is so true.
At the QEH.
That is so true.
So talk to us a little bit about the role that you play generally in taking care of people who not only may have arthritis, but other conditions as well.
Okay, so physiotherapy at the QEH has both an inpatient, an outpatient, and a satellite component, Harrison Point and St. Lucie District Hospital. We manage from pediatrics to geriatrics. We have intensive care management, where we mobilize patients who are ventilated and extremely ill and dependent. We have to get them mobile, we have to keep the chest clear, we have to get them stronger so they can get out of the ICU, back onto the ward. When on the wards, we also have to continue to strengthen and get them ready to go out of hospital back into the home life. We manage our amputations, we manage our strokes, and other neurological conditions such as your spinal cord damage, quadriplegia, paraplegia, those who've had the spinal cord damage and now the nerves no longer work below a certain level. We manage persons who've had regular surgeries who need to be also, because of the pain, they don't want to move. We manage cancer clients, patients who would have particular breast cancers, and then sometimes the resultant drainage patterns in the system in the hand doesn't work, so they get a particular type of swelling. We have a specialist who works on helping to clear that. Our children who are asthmatic, who may have pneumonias, who may have fractures, we also manage them. And then, of course, we manage your fractures for broken hands, broken legs, back pain, some of which is arthritic, like neck pain. A lot of that also has arthritis components. So we manage a significant part of the population of the QEH. We're not a sexy department. You come to us when you're at your worst, when you're sick and when you're painful. But we do a really good job. Our clients are actually very pleased with our outcome. We see approximately between 100 to 120 persons per day. We mobilize them, we get them back out. Now, not every person is going to be a success story, but we've had some wonderful success stories over the years.
Oh, that's excellent. We're going to invite you back because this discussion has left me with more questions.
That's understandable.
That I even had
We'll be
before,
glad to come back.
But I think it would be worthwhile to explore all the ways that physiotherapy can really help us as we go through our days and to really manage pain and get back to a state
I look forward to that invitation.
Function well. Thank you so much for coming in. Dr. Gerry Warner is Chief Physiotherapist at the Queen Elizabeth Hospital, talking to us on this World Arthritis Day. And Granny, you were right. Your joints can tell when the rain is coming. He said it.
Yes.
All right, we're going to take a break here and come back on Morning Barbados. Stay with us.
Morning, morning, morning. Good morning.